nature's best, Bobtail.
Welcome back. It is your Feel Good Morning Espresso here on SABC3, and we are talking pet health with our celeb vet, Dr. Roy Aronson. And now is your chance to ask those pet-related questions that you've always wanted to ask. So you can phone in right now, 083 91 33728. Now, this morning is all about your pet vomiting and how do you know when it's serious or not. Dr. Roy, how's it, man? You well?
Yes, thank you, and yes,
Good. That's a very broad subject we are talking about this morning, pet vomiting. So I think let's first start. What are some of the causes when it comes to vomiting?
You know, they are so numerous that to try and actually list them is impossible. So what I've done is I've just divided it up into three very broad categories. Young animals like puppies, adult animals, and old animals. Young animals that come in, I would certainly deworm them. Think of worms. Nutrition. A lot of people feed their dogs things like milk and Pro-Nutro, which in an ideal world, it's not a great food. There are a lot of milk allergies, and certainly milk is one of the big causes of dogs vomiting. Now, I know there are lots of people out there who feed their dogs milk and nothing happens, but when they come to us, if we find that they've had milk and Pro-Nutro, you stop it and the problem goes away. And then another problem in puppies is what we call blockages. They've got young bowels and they can actually obstruct. They can get what's called an intussusception, and that's a problem. Adult animals, once again, nutrition. And then if your dog goes out onto the beach and eats seaweed, your staffy goes out and eats seaweed. Unfortunately, the seaweed can block the bowel. If the dogs go out and eat stones or big sticks, once again, those things block the bowel. And that's a major problem that needs to be relieved. And then older animals, when you've got a geriatric patient, dogs over 10 or 11, they start vomiting. I would certainly be concerned about blockages once again, but by things like cancer. Cancer of the bowel can block cancer of the liver. So you know, there's many reasons. Those three categories.
So we have someone on the line. Michael, you're on the line from Knysna. Morning.
Hi, good morning.
Morning, Michael. Morning.
So what is your question for Dr. Roy?
Hi, Dr. Roy.
Hi.
I've got a dog. He's about 7 years old, a crossbreed. He's got Addison's disease. We're having him on Florinef medication. And sort of once or twice a week, he vomits, but it's like almost nothing there. You know, it's almost like a lot of foam and stuff like that. Is there, my question is there anything to be concerned about? And secondly, is there an alternative for Florinef?
Wow, that's a big question. A very brief question. Is your dog still drinking a lot of water?
Oh, he drinks tremendous amounts, yes.
Okay. Because what happens is they drink a pile of water and it hits the stomach and it's just the volume is too much and they vomit it up. So just a very, very broad tip. Instead of giving him free access to water, don't give him less water, but try and limit his intake on an individual basis. In other words, if he has that much water, give him that much, but in small increments. And if you give him a little bit of water throughout the day, his stomach may not be distended quite as much as it usually is, and that may help. But it's a big question, and it's a tough disease. You can never stabilize it completely, and you will always have fluctuations. But try and split the water up.
Super.
Thank you for the question.
Thanks, Michael. We have another caller on the line, Dr. Roy. Shahima, good morning. You there?
Good morning. I'm here, yeah.
Good. You well?
Morning, Shahima.
Good, thank you.
Good. What's your question for Dr. Roy?
I've got two female cats. They've been sterilizing that. Now, what they do is they wee little bits all over the show, whether it's in the room, against the couch, whatever the case might be, outside, little bits all the time. What could I do with this?
Okay, my first question to you is, are your cats sterilized?
Yes, they are sterilized.
Okay, then if they're urinating all over the show, they're marking territory, it means that there may be another animal outside that's coming into their orbit and causing them a bit of stress, and they're trying to mark territory to show where they live, to try and exclude the other animal. It is a behavior issue more than a disease, and you need to look to try and exclude the other animal from the environment.
Even if it's a female, I know the male does it.
No, unfortunately, males and female cats are very territorial, and they will try and stake out their turf, and they do that by marking like that. Uncastrated males are a big problem, But you put another animal into the female space and she's stressed and she'll try and mark her turf.
Oh, my word. Okay.
Hope that helps.
Thank you.
Great stuff. Thank you so much, Shahima. Dr. Roy, thank you so much for answering these questions that are coming through. And of course, just remember, every time your dog vomits, you just need to look at it and assess it, but it is alternatively better to take it to your vet to have it checked out. But don't forget to catch Dr. Roy once again next week Friday so you can ask those questions.
Stay with Espresso and SABC3.